Now, submandibular region extends now the submandible, just below the mandible. It is now extends from submandibular fossa of the body of the mandible to the hyoid bone. Now, submandibular and sublingual glands, suprahyoid muscles, extrinsic muscles of the tongue like hyoglossus, genioglossus, and styloglossus. This hyoglossus from hyoid bone, from this is genioglossus of the tongue, and styloid process to the tongue. Now, lingual and hypoglossal nerves, submandibular ganglion, lingual and part of the facial arteries. Now, this is a picture. You can see this is the tongue. This is the portion of the mandible. And see the glossopharyngeal nerve is styloid process, the stylopharyngeus muscle, this is the sublingual gland, the digesting anterior belly. The mylohyoid vessels and nerves, mylohyoid muscle and submandibular gland superficial part. This is the submandibular gland superficial part. The facial artery, the cervical part of the facial artery, and the lingual artery. This is the lingual artery. And hypoglossal nerve, middle constrictor, submandibular gland deeper part, submandibular ganglion, this is yellow, and hypoglossus muscle. Now, this is the picture that's very important. Now, introduction. Submandibular gland is a mixed gland, lies in the digastric triangle and partly lodges in the submandibular fossa of the mandible up to mylohyoid line opposite molar and premolar teeth. The gland consists of large superficial part and smaller deep part. Both parts are continuous around posterior border of the mylohyoid muscle. Now see, this is the portion of the mandible. These are the mylohyoid vessels and nerve, the mylohyoid muscles, and these investing deep cervical fascia. The fascia, and it encircles the superficial part of the submandibular gland. Now this is the facial artery. This is the facial vein, this is the platysma muscle, and this is the skin. You see, if there is a calculi in the submandibular duct or some growth, then if he or she takes sour, khatta, then it will swell up, and there will be pain also. Parts superficial and deep. Superficial, two ends, anterior and posterior. Three surfaces, inferior, lateral and medial. Anterior end extends up to anterior belly of digastric. Posterior end extends up to stylomandibular ligament, which separates submandibular and parotid gland. Investing layer of deep cervical fascia splits into two layers to cover inferior and medial surfaces of the gland. Inferior surface, skin, superficial fascia, platysma, deep cervical fascia, common facial vein, cervical branch of the facial nerve under cover of platysma, and submandibular lymph nodes beneath the deep fascia. Lateral surface, submandibular fossa of mandible, medial pterygoid muscle, facial artery loop between bone and gland. Medial surface, it has three parts, anterior, posterior and intermediate. Anterior part, rest of the mylohyoid separated by mylohyoid vessels and nerves. Submental branch of the facial artery. The posterior part, styloglossus, stylopharyngeus, glossopharyngeal nerve, posterior belly of digastric, middle constrictor muscles of the pharynx, hypoglossal nerve, first part of the lingual artery. Intermediate part rests on the hypoglossal muscles, lingual nerve, submandibular ganglion, hypoglossal nerve, pair of vein corresponding to hypoglossal nerve, intermediate tendon of digastric. The first beginning slide, that picture you please note and see. Deep part extends forward in interval between mylohyoid and hyoglossus up to posterior end of sublingual salivary gland. Relations of the deep part: laterally mylohyoid, medially hyoglossus, above lingual nerve and submandibular ganglion, below hypoglossal nerve and accompanied by vein. Submandibular, specially made apron or some shirt to put in all these gadgets. You just have to wear the jacket. Submandibular duct begins from the middle of deep surface of superficial part of the gland behind posterior border of the mylohyoid, passes upwards and backwards and then runs forwards and upwards through deep part of the gland between mylohyoid and hyoglossus, then runs between sublingual gland and genioglossus and opens in the floor of the mouth and sublingual papilla on each side of the frenulum linguae. When you see the mandible, now this is the tongue and look at the frenulum lingually. The other day I told you the tongue tie. I told you about tongue tie when I explained the tongue. So it opens in the then runs between the sublingual gland and genioglossus and opens in the floor of the mouth and sublingual papillae on each side of the frenulum lingually. Yeah. It is no. Wharton's duct intimately related to the lingual nerve. Wharton's duct intimately related to the lingual nerve. At first, nerve lies above the duct, then crosses it laterally, lateral side and ascends medially, winding around lower border of the duct. Now, you have a swelling here, acute pain, and you think of incision and drainage. No, no, no. It is a highly dangerous area, and also you should refer, don't drain, just drain, you might cut the duct. And also what happens, there will be a fistula. Saliva, any khatta, mitha, not mitha, any khatta he or she takes, there will be drainage, like a fistula tract will happen. So you please refer this person to the ENT surgeon, especially head neck surgeon. Okay? Deep structures of the submandibular gland. After removal of superficial part of the gland and mylohyoid muscle and breaking body of the mandible, Hyoglossus muscle, genioglossus muscle, styloglossus muscle, deep part of the submandibular and sublingual gland, stylopharyngeus, middle constrictor, part of the glossopharyngeal nerve. This much, and your see, it can be a short question. Short means 4 marks or 10 marks. It's mainly related to the describe the submandibular gland and course of the duct, where it opens, and even when you do a viva, hard part or soft part, then your bones, the mandible, if it is asked, then you might they not might they have the questions on submandibular glands, where it opens, what is the course, and the muscle. See this portion of the muscle. Now you saw the muscle related to the tongue and uh, uh, your the uh, your pharynx. All these muscles are coming from this part, and you see the skull. We have beautiful skulls. Please see the styloid process. All this content of the head neck region, mainly the skull, you have to know very well. So once you know the skull, then and the individual bones, we are having individual bones, and you have to. I told you, one of batch yesterday that you take the skull, you take the base of the skull, and take the bones in your group of 5, and you try to assemble it. You assemble it, and slowly you get the total story. And when the soft part will be taught to you, then you, in your revision, you have the soft part in the table, you have the bones. But whatever is being taught to you now, take it as the final lap, because you have to give a internal assessment exam. So I'll just go through the pictures. Now this is just a recapitulation and revision, whatever you say. It is this slide, you will have it in your books also, or your atlas. Now, this portion. The mylohyoid vessels and nerves here. Mylohyoid muscle. Okay. Now, here the platysma, the muscles in the neck. Because see, the platysma muscle is a thin layer of sheath, a thin layer of muscle. And if any portion of the neck is your burnt or injured, you have to take utmost care. How much? To dress the wound also, and then you put a collar so it doesn't get stiff like this. You see in pictures in your books, medical books, the child, especially children, they get now you dress accordingly and support temporarily. Oh, you take out the collar and rest for 1 hour, 2 hours, and again put in. And very first day you start the movement of the neck, 22 slides, 22 slides. Out of that, 5 figures are there. Any portion, Wharton's, your duct, and one thing is that any calculi or something is there, then you have to sialogram. Sialogram, you inject a dye and then take the radiograph.